Okay, well, let's get started. So, for those of you that don't know me, I'm Helen, and I'm a registered nurse and a life coach, actually. And I have spent many years working in psychiatry in South Auckland, and have over the years become very passionate about how we can really support our mental health outside of the traditional medical model. And I'll talk a little bit about that. So I belong to a couple of Facebook groups, and I really see people struggling with their mental health. And I find it kind of sad that there's not a lot of knowledge about what people might be doing to what they can do to help their mental health, or what they might be doing that's actually harming their mental health, and they don't realize that. So I just thought, oh, I'll volunteer some time and energy to talk to whoever's interested about what we can actually really be doing to support our mental health and well-being. And so tonight we're going to cover some basic everyday essentials that really supports our mental health. We're going to look at some things that make our mental health worse, and we're going to look at some mental health hacks. Now, when I talk about mental health, I'm not talking about just the absence of mental illness. So we all, we know about mental illness, and we know about diagnoses, and you may or may not have a diagnosis. And what I'm going to share tonight is going to help you whether you've got a diagnosis or not got a diagnosis. What I really want to talk about as well is mental health from a very holistic point of view, and that's really about living a life that you enjoy, that you feel passionate about. So it's not just simply the absence of mental illness. And so a little bit more about me. So like I said, I'm a nurse. I worked in psychiatry for many years, and I left mainstream psychiatry about 9 or so years ago. I was incredibly frustrated at the medical model. So I'd worked in frontline psychiatry. I worked with crisis team. I was what they call a dually authorised officer. So I was part of invoking the Mental Health Act. I worked in the emergency department in South Auckland for people that came in with acute psychiatric issues. And, the medical model is very much medication and talk therapy, and there's not really a lot. I mean, it's getting better. It definitely is getting better, but there's not a lot outside of that. And if any of you have experience going along to doctor or a GP and not feeling that great, sometimes that's the first thing that is offered is, well, the oral contraceptive pill or an antidepressant. And I just think there's so much more we can be doing, and the more knowledge we have. So if we look at here, the more knowledge we have, the more empowered we feel about what we can do to support the way we feel. And there is always something that you can do, even if you are tired and struggling. Sometimes very small things can actually support you to feel a bit better. The important thing also is that you're not alone, and I think a lot of these Facebook groups have really supported that notion of you're not alone when you're struggling. You're not the only one that experiences difficult emotions. And the other thing is that it's not your fault. You haven't done anything wrong to be feeling this way, and I think that's very important as well, because sometimes we carry this guilt around with us that we've done something, or that there's something wrong with us. That's definitely not the case. So this is really important to understand. So these are the things that I have found in research that contribute to poorer mental health. So it's a big list. And I think we often think of poor mental health as just something that happens in the brain. And yet there are so many things that can contribute to poorer mental health. Oh, that's okay. That's all right. Someone's just having difficulty with sound. So it's really important to understand that, it's a really complex thing. So inflammation in the body can cause poor mental health. Chronic disease, loneliness. Well, some of these things we know, like some of these psychological factors we really know contribute to poor mental health. A poor diet, which I'm going to be talking about tonight because this is a topic I'm incredibly passionate about. Being intolerant to certain foods, and I've had people, that have got food intolerances that make them feel really irritable and cranky. And you take out those foods, and their mood improves significantly. Unstable blood sugar levels, obvious things that we know like job dissatisfaction, but there's also low levels of vitamins and minerals and good fats can definitely contribute to poorer mental health. High intake of trans fat, I'll talk a little bit about that tonight. Like I mentioned, other vitamin deficiencies. And sometimes these vitamin deficiencies can occur even if your diet is really, really, really good, even if you have the best diet, because our soils are deficient in some minerals. We know about things like childhood trauma and life events. There's a strong association between irritable bowel syndrome and inflammatory bowel disease and poorer mental health. Thyroid issues, parasites can impact your mental health. Gut issues are huge, actually, and more is coming up about that. Alcohol and drug consumption. And some medications can impact your mental health as well. So one of my pet peeves is something called omeprazole. So omeprazole is a medication that reduces your gastric acid, and it's often prescribed if you have some stomach issues. And omeprazole is great in the short term, but it's often left on for long term, and it can reduce your ability to absorb vitamins and minerals, and this can really impact your mental health, and it's been associated with poorer mental health. So this is just to say, all these things can contribute, and it's just really important to understand that it's not just one thing, and there's not just one answer necessarily when we're looking at how do we support someone who's depressed, or how do you support yourself. So tonight I'm going to talk about some of the real basic things, and sometimes I'm embarrassed to bring this up because I'm like, these things are so basic. We know about them, but we forget how important they are. And so the basic things that we've often talked or heard about for physical health are also incredibly important for mental health. And so I'm just going to walk you through some of these and discuss a little bit about why they're so important. And I think that when we understand why they have such an impact, we can really start to focus on them and actually make sure that we look after some of these basic things really, really well, because they can have such a significant impact. So we're going to talk about sleep. We have a normal circadian rhythm, so we have a normal sleep-wake cycle. And this sleep-wake cycle can affect other hormones in our body. And so it's really important that we stick with a good sleep-wake cycle as much as we possibly can. Research has shown that people with a really poor sleep pattern, so they've done research and they've taken a bunch of people and they've looked at their sleep habits, and those that have poorer sleep habits are more likely to develop poor mental health a year or two down the track. So sleep is so important for resilience. You will know if you have a terrible night's sleep, you're less resilient, you don't cope as well. But it goes much deeper than that. And actually, it increases inflammation in your body if you're not sleeping well. Your cortisol levels, your stress hormones increase if you don't sleep very well. You want good cortisol levels in the morning, but they should decrease as the day goes on, so that when it's time for you to go to sleep, your body's relaxed and you can actually get off to sleep. So sleep is incredibly important for good mental health, and I really want to emphasize that it's one of the core things that we know impacts how we feel. So often when we're not feeling very energetic and we just want to lie in bed and watch Netflix, and we stay up quite late, or we stay up till 2 o'clock in the morning because it's I don't know, it's what we do, and we want to avoid doing things, or we don't want to think about it, or we can't sleep, so we, watch telly or whatever. But actually, it's very disruptive to our brain state and to the hormone state as well. So there's a few tips on here about aiming to get at least 7 hours at night, 7 hours a night, and bed by 10, get into routine, sleep in a dark, cool place. Snoring can really impact your quality of sleep. So if you're a snorer or your partner's a snorer, changing position or actually figuring out what that might be related to can be a really important thing to sort out. Using meditation, mindfulness, or relaxation exercises in the evening. And actually, there's been some research that says that people that journal and do like a gratitude journal before they go to sleep actually have improved sleep. And I think it might be something about just getting rid of your thoughts. And often it's when we go to bed and go to try and get off to sleep that our brain goes, oh, hang on, what about this, what about that? So writing stuff down before you go to bed can be really, really helpful. One of the things that really helps to support our circadian rhythm and our sleep wake cycle is to expose your eyes to light in the morning. And so getting out, actually going outside and experiencing sunlight, natural sunlight through our eyes can be really helpful for setting up the sleep wake cycle. And likewise at night, we want to decrease the lights. We want to turn off or turn down the lights in the evening. And that can help us to actually get into a more sort of sleepy state. Supplementation can be helpful for some people that struggle. And obviously, we know about avoiding caffeine and alcohol. Alcohol is a real disruptor of sleep. Sometimes, we feel that, oh my God, we just want a glass of wine to wind down. Actually, it's quite good at getting you off to sleep, but as soon as the alcohol wears off, you get a sort of a response, a wake response, and actually, it actually causes a really disruptive sleep pattern, unfortunately. Sugar can have a huge impact on your sleep pattern, and I'll talk a little bit about that further on. And exercising, you want to exercise during the day and not too late at night. You don't want to be too stimulated. So one of the other things that I want to talk about is movement. And I think movement is something that sort of don't always associate with mental health. And we don't understand the importance of it. But, and I call it movement rather than exercise, because I think when we think about exercise, well, for me anyway, I think about, oh God, going to the gym or something that, you go and do your exercise. The research talks about exercise. So that's why I've got exercise on there, because that's what they study when the research is looking at movement. They call exercise, obviously. But really, movement can be incorporated in everyday life. It doesn't have to be something specific. Gardening, housework, playing with your kids. I mean, if you're a busy mother, you're up and down all the time doing things, lifting children, whatever it is. And so it's about movement and moving regularly. That's really important. Exercise can release endorphins. So, these sort of feel-good chemicals, serotonin, dopamine. It reduces the hormones related to stress, such as cortisol and adrenaline. The positive effects from doing a good bout of exercise can last 12 hours. And like I said, it's less about exercise as such and more about physical activity and really, bringing this into your everyday life. The research says that as little as 2 hours or as much as 6 a week, this is not a day, don't panic. It's as little as 2 hours a week is enough actually to improve your mood. Now, for some reason, there's like a bell-shaped curve where as little as 2 hours, but not much more than 6 hours seems to be the right amount for mental health. So I'm not talking about physical health, I'm talking about what the research says for mental health. And for some people, I have had this, that people do almost too much exercise. And for women, especially if they're not giving themselves time to recover and they've got a very busy life otherwise, they can end up getting sort of this chronic, no, I don't want to say chronic fatigue, but fatigue, like getting really, really tired. So it's nice to have a little bit of a balance out that around that. So the other thing about exercise is that exercise has been shown to be as good as an antidepressant in some cases. So even when you don't feel like it and you're really struggling, a 5-minute walk. I mean, I remember the times in my life when I would just think, oh, oh my God, do I really have to? And I would come home from work and I would literally put shoes, I wouldn't even walk, I would hardly walk in the door. I just take off my work shoes, put on some sneakers, and I'd just turn around and walk out the door. And I think, I'm just going to go to the first lamppost. That's what I'm going to do. And once you're out, you often, go to the second lamppost and you do it around the block or whatever it is. But the smallest amount of exercise can actually be really therapeutic and really helpful. So don't be put off by thinking it has to be, I have to go for a 5K walk or anything like that. It really is, small amounts can be very powerful when it comes to our mental well-being. So frequency is more important than intensity. So moving regularly is more important than a massive walk, all at once. Did somebody want to say something, or is there somebody have a question? This is some noise. You can pop yourself on mute if you like. It might make it a little bit easier so you don't have to be super quiet. So, like I said, movement in everyday life. Do something you like. And I think that's the other thing as well. Like if you do feel like you want an exercise regime and you hate the gym, don't go to the gym. Find something that you really enjoy. 15 minutes twice a day is enough to start. Like that really is enough. Less if that's all you can manage. Just start small, just do a little something, and putting on your shoes. And like I said, I just put on my shoes and I'm just going to go outside and see what happens. And, start with 5 minutes. And I've got this lovely thing called the 10-minute anti-procrastination rule, which is when you really don't want to do anything, you can just say to yourself, can I do this for 5 minutes? Or can I do this for 10 minutes? And often the answer is yes, I can do this for 10 minutes, whatever it is, whether it's cleaning or, study or whatever it might be. Can I do this for 10 minutes? Yes, I can do this for 10 minutes. Set a timer and just do it for 10 minutes. The same for walking. And if it's 5 minutes, can I do 5 minutes of exercise? Okay, so I'll set a time, I'll do 5 minutes. And sometimes that's it. You're like, I'm done. I've done my 5 minutes. But sometimes you're like, I can do another 5 minutes. So sometimes it's the getting started. That's super, super important. Does anybody have any questions about that at the moment? You're welcome to unmute if you want to have a chat. Carry on. Okay. So we're going to talk about one of my very favorite subjects, and that is food. And favorite for a number of reasons. One is that I like eating, which is very important. But the other is that it has such a significant impact on your mental health and well-being. So in the olden days, we had this old pyramid, the eating pyramid, and that has long gone. So that's truly out. But we now have the Ministry of Health. There's a new plate, and this is what it looks like, choosing a healthy plate. So there's some general dietary guidelines around this. I'm going to come back to this in a minute because I really want to talk about why food is so important. So when we eat food, this to me was a total game changer. When I learned this about the importance of why you needed to eat good food, I was like, this totally makes sense now, because we're often told about eating a good diet for our physical health, for cardiovascular disease and to keep us healthy. But not very often at all is diet discussed when it comes to mental health. And it's beginning to be talked about a little bit more, but it's not something, for example, if you go and see a psychiatrist or a psychologist, generally, will they really dive into your diet and ask you about what you're eating and maybe give you some suggestions. So I was doing a bit of research around this, and I remember listening to a podcast and hearing them talk about how neurotransmitters are made. And we talk about neurotransmitters, so things like serotonin, dopamine, GABA, melatonin. So we've heard these terms bandied about before. And basically, we want a good balance of neurotransmitters to actually support our mental well-being. And so the interesting question was, well, how are these neurotransmitters made in our body? Like, where do they come from? And I'd never thought about this. I never thought about any of this, actually. And where they come from is actually the neurotransmitters are made from amino acids. I'm not going to get too complicated about this, but amino acids come from protein. So when we eat protein, now protein, yes, is meat, but it is also in vegetable sources and legumes and grains. So when we eat foods that contain these amino acids, these proteins, break down into amino acids, they come into our stomach, they get broken down by our hopefully healthy digestion. They turn into amino acids. And then amino acids need vitamins and minerals. So you have these little amino acids like tryptophan, and it needs these lovely cofactors. It needs vitamin C, it needs zinc, it needs magnesium, it needs iron, folate, to actually transform itself into a neurotransmitter. So if your diet is quite deficient in some of these nutrients, you might find that you become deficient in some of these neurotransmitters. And if you're on an SSRI, so if you're on something like fluoxetine, and you have very low folate levels, people with very low folate levels have a poorer response to SSRIs. They don't respond as well to antidepressants. And when you see how this works, you can kind of understand why this might be the case. So I know of some people that have been started on an SSRI, didn't respond very well. Person was then given some folic acid as a supplement. So folic acid is a form of folate. Our body makes it into folate, and that then their mood actually improves. So really important to understand why nutrients are so important when it comes to making our neurotransmitters. And so when it comes to food, it's really important to, so I'm going to go back to this eating well, to have this balanced plate. And this is why, unfortunately, so many of those vitamins and minerals are in vegetables. Some of them are in meat as well. So in protein, there's a lot of the B vitamins, for example, B12, B6, folate is in green leafy vegetables. You'll find that a lot of these nutrients are just is what you get from eating a really sort of whole food diet. And this is why eating well is incredibly important for your mental health. But it's not just about what we eat, it's what we eliminate from our diet as well. So I'm going to talk a little bit about that. If you're gonna make some changes to your diet, they don't have to be huge. You don't have to like completely reinvent your diet all at once. Some of the simplest additions, like just adding in another vegetable or adding in some extra fruit, for example, the research shows can make a significant difference in your mood. So you don't have to go nuts, but small changes, small additions, little bits at a time can actually make a big improvement. I'm going to talk a little bit about supplements as well. Food should always be first. Food is always this is where you're going to get the complex. There's nothing like real food to get the complex sort of integrated mix of fiber and polyphenols, which are really supportive for our gut microbiome. You're not going to get that from taking tablets. So really food should be the first thing. However, as I said before, if you can have a really good diet and still end up deficient in some vitamins and minerals. And so I just want to talk you through some of the vitamins and minerals that have been found to be really good for mental health. There's been a lovely study in New Zealand actually that looked at vitamins and minerals for premenstrual syndrome. And a really high dose multivitamin was found to reduce or eliminate PMS for something like 67% of the people that went on that used them as part of the trial. So Vitamins and minerals in very high doses have been found useful for other mood disorders and also for anxiety. So B vitamins, for example, have been found to be very good for people under stress and with depending on what's going on, that can be very important for energy levels as well. Zinc has been shown to be very important for mental health and low levels associated with poorer mental health. We've talked a little bit about folate, but so for some people, it's really useful to actually take a supplement to top up what's missing in your diet, and they can make a significant difference. You really want to get really good quality ones, which I can talk about later. There are some herbs that have been shown to be really useful as well. So one of my very, very favorites is ashwagandha. Ashwagandha is a wonderful herb that can help reduce stress. So it actually helps reduce your cortisol. Same with rhodiola. Lavender's been found as a supplement, believe it or not. It's been found to be good for mood as well. Passion flower has been found to be very relaxing. So there's some different herbs that you can add as well. You have to be careful if you are on medications. You always need to check with your pharmacist or your GP before you add any of these in. But in many cases, you can add some herbs along with medications and it's not a problem. Some people have tried amino acids just as a supplement, and that can be very useful. And some people have also used probiotics. And so the research is really mixed about the probiotics. Probiotics are very good for the gut microbiome, for your gut health. And for some people that struggle with gut and mood, probiotics can be really helpful for that as well. So just some ideas on some supplements that you could think about or consider. So I want to talk about, so these are the things that we can do that really support our mood and to make it better. So focusing on sleep, really making sure that sleep and rest, taking breaks is really essential. Moving regularly, so moving during the day, super important, getting movement in, and having a good balanced nutritional diet is super, super important. So I'm going to take you through some of the things that what makes our mood worse, because there are some things that we do that definitely, unfortunately, contribute to a poor mood. So you see the things I'm talking about are the very practical things. I'm not really talking about the psychological side of things in this presentation. I'm really talking about physical, practical things that we can engage in. And one of the biggest contributors that I've seen in the research that impacts our mental health and well-being is actually junk food. And there's been some amazing research come out recently and really associates people that eat junk food basically have a very strong association with a poorer mood. And the more junk food you can consume, the worse that your mood is likely to be. And there's a number of reasons for this. I mean, obviously, junk food is generally has poor nutrients. It's not very high in nutrients. Some of the ingredients actually have specific effects on brain cells, which is quite frightening. So I mentioned before about trans fats. Trans fats are fats that are found in really heavily processed foods. In the olden days, we were told to, not eat butter anymore, we need to eat margarine, but actually they found out that margarine was quite high in trans fats and not good for us. Trans fats are found in, donuts and pies and cakes and baked goods that you buy commercially. And trans fats have been found to actually take the place of good fats in your cells, and that includes in your brain cells as well. And people that consume trans fats have high levels of aggression, agitation, and sort of irritability. So trans fats can have a significant impact on the brain and on your mental health and how you're feeling. Some junk foods actually sort of seem to deplete the body of certain nutrients as well. And the impact can be immediate. So you may have something, and you certainly notice this if you have kids. Some food colorings, for example, have been associated with increasing ADHD symptoms or autism symptoms. And so some of these are really short term, but some of these are long term. Some of these are really things that you'll see over a period of time that you might not notice immediately. But I think when we get really clued up about what we're eating and how we're feeling, you may actually notice that you have something in an hour or two later, you think, oh, didn't make me feel that great. I've got some sad news about alcohol. So I mentioned alcohol earlier, and regular alcohol consumption has been found to raise your cortisol levels, your stress hormone levels. So cortisol is considered a stress hormone. And what they've found is that if you don't have to drink a lot, so you're not someone that's coming home drinking a bottle of bourbon a night or something, just a couple of drinks a day. So, and not even every day, but 2 glasses of wine, and say if you're doing that 5 nights a week, and I'd say that that's relatively common. What they've found is that even when you're not drinking, you actually have higher levels of stress hormones in your body. And you can understand how this becomes a real cyclic thing, because you're feeling quite stressed, you come home from work, or at the end of the day, you have a couple of glasses of wine because, boy, we need it. A, it interrupts your sleep, but B, actually increases your stress levels, your stress hormone levels. So knocking alcohol, and I've seen this a lot. This is another thing for anxiety as well. I've seen this a lot in people, and it's sort of one of those things that's really hard. It's like, do you think you could just try not drinking for a couple of weeks and just see how you feel? And it's amazing how many people come back and go, oh, actually, I feel a lot better. My anxiety's gone. I'm sleeping much better. I'm generally feeling much better. And the studies have shown that depressed mood is substantially alleviated within a very short time from abstaining from alcohol. So unfortunately, there's not really much good in alcohol at all. And we've talked, they talk about resveratrol and, glasses of red wine. And I'm not saying you should stop completely, but when it comes to mental health, it's definitely something to be aware of. Blood sugar dysregulation. So I've talked a little bit before about the impact of sugar, and sugar can really disrupt sleep, because what can happen is that when we consume a lot of sugar or foods that have got a high glucose level, so it doesn't need to be sugar as such, but fruit drinks, obviously soda, fizzy drinks, what happens is that we get this peak of sugar in our blood, and then our bodies releases insulin, which to try and get the sugar into our cells. And what happens is we can get a too high peak of insulin, and it can drop our blood sugars, and you end up having this sort of zigzag of blood sugar levels, high, low, high, low, high, low. And when we go to sleep at night, what can happen is that you end up getting a drop in your blood sugar levels, because you've had this kind of high sugar most of the day. Your body's not adjusting well to the blood sugar dysregulation, and the drop in blood sugar level can actually wake you up. So your body's kind of like, whoa, where's my sugar? And so you end up getting quite disrupted sleep. It can contribute to increased fatigue if you're having sugar spikes regularly, obviously poor sleep, anxiety, mood issues, irritability. And high sugar levels are associated, just in the research, with poorer mood as well. So with depression, anxiety, and even schizophrenia, I think is some interesting research around that. So something just to be really aware of is it's just how our food is actually impacting our mood, and how it might be contributing to how we feel on a day-to-day basis. So one of the other things that I mentioned, if we're not focusing on these basics, and I use this myself. I know when I'm feeling a bit flat, or if I'm thinking, I'm losing energy, I really don't feel like doing anything, or I'm starting to feel, anxious, whatever it might be, if I'm not feeling good within myself, the first thing I will do once I realize and get out of my own head is come back to, like, okay, what am I doing these 3 things? Am I focusing on my sleep and rest? Or have I been staying up late? Or is something else disrupting my sleep? Have I done any exercise in the last 24, 48 hours? What am I doing around that? And have I been eating well, or have I kind of slipped off and had cheese and crackers for dinner, a night, or, whatever it might be that be impacting my diet. So it's something I come back to quite regularly for myself. It's not everything, but I just think that if you sort of get these three things, you're like, right, if you've got those three things, okay, so then you need to look at what else it can be. But it's just that often we don't. Often we look at things way outside the circle and we blame all sorts of other things. But I think that these are just so, so important. So come back to these things regularly because they really are essential for mental well-being. So I want to have a look at what else helps. I'm just going to look at time. Gosh, a little bit over, but what else actually, we're fine. I was thinking we had half an hour less, but what else helps when it comes to mental health? So this is a really odd one, breathing, because I mean, we all breathe, obviously, but it's the way we breathe that's very, very important. And breathing is an essential part of health in general. But we often can get stuck in a sort of a fight or flight mode. So we often can end up being in a breathing pattern that's very short and shallow. And short and shallow breathing pattern actually feeds the stress response, so to speak. And one of the quickest things that we can use to actually calm our body down and invoke what they call the parasympathetic nervous system. So this is the rest and digest system. It's the system that's involved with relaxation, is to actually focus on our breathing and actually change our breath to be deep, slow, long, and through the nose. Mouth breathing is associated more with a stress response. You know that when you are running, you tend to breathe through your mouth. It's kind of like you need, the oxygen. But actually, if we can change our breath when we're feeling stressed or anxious to a nasal, long, slow as you can, relaxed belly breathing, this can really actually give signals to your brain that actually everything's okay and we can calm down and we can relax. So there are some lovely studies that suggest that just breathing exercises can significantly reduce long-term anxiety and depression. So quite powerful. Hydration. This is something as well that we often forget. I certainly forget when I'm busy some days. Our brain is 75% water, apparently. And dehydration can definitely affect our mood and make us feel a little bit anxious and can reduce our cognitive ability, as our ability to think well. So it's another thing to really remember is to think about, am I hydrating? Am I drinking enough water? And I know that often I'll feel fatigued and I'll think, oh, you know what, I haven't drunk any water for the last however many hours. So drinking a couple of glasses of water, I'll find that after a little while, feel a bit better, think clearly. So this can be quite important just to get through sort of every day. And I think sometimes we have those slumps in the day as well, like the 3 o'clock slump. I don't know if any of you experience that. When we just sort of get quite low in energy, going for a walk and hydrating, I think can be two of the things that I really find makes a really big difference. So a little bit about cold water immersion, and I know that this is a little bit of a thing at the moment, and it's kind of novel or a bit weird, but there's lots of research that's coming out now about how cold water and immersing ourselves in cold water can be really useful for our physical health. So it stimulates the immune system, but actually it's been shown to be good for our mental health as well. So it releases hormones, so both stress hormones, but also the good hormones as well, so endorphins. And a lot of people are finding like it's a natural antidepressant. It kind of wakes them up. It makes them feel good for the rest of the day. The other thing about cold water immersion is that it's a little bit of a psychological exercise. And so if you can practice putting yourself in a stressful situation, such as cold water, and you can teach yourself to breathe through it and sort of calm your body down instead of like yelping and screaming and, fighting that desire to get out of the water. It's actually been shown to help you cope in other stressful situations as well. So you're actually using the technique that you practice when you're getting into cold water, you're using that in other stressful situations, and it's been shown to be really beneficial. So it's just something to be aware of. I'm lucky I live by the beach, and so I've made a promise to myself that I go swimming at least once a week, even through winter. So I did some training. I did some ice bath training a few years ago, and that completely changed because I used to be one of those people that would take like 20 minutes to get in the water, even in the summer. I'd be, oh, it's cold. Oh, no, I don't like it. Whereas I've really now just taught myself, and now I just walk straight in, and yes, it's cold, and yes, I'll feel it. There's no doubt about it. But the training of the breath and just knowing that my body knows what to do. My body knows what to do in cold water. It's not going to freak out. It's all good. It'll adjust, and it knows what to do. And there's something about that that can really prep us for other stressful situations as well. Sunlight, I've talked a little bit about how sunlight is associated with a good sleep-wake cycle. But exposing your body to sun has also been shown to improve your serotonin levels, and decreased sun exposure is associated with a drop in your serotonin levels. And you certainly have heard about seasonal affective disorder, when you're not getting much sunlight and your serotonin levels can actually decrease, and that can impact the way you feel. The other thing about sunlight and exposing your skin to sunlight is that you get vitamin D. Now, there are some really interesting studies. They looked at vitamin D levels of people being admitted to a psychiatric hospital. So they got basically blood tests of the people admitted to a psychiatric hospital. And in some of those research studies, around 90% of people had low vitamin D levels. And this was when they came into hospital. So it wasn't like they were in hospital and then their vitamin D levels dropped because they were in hospital. This was prior to coming to hospital. So there's a real association. Now, we can't necessarily say that low vitamin D causes mental illness or anything like that, but there is an association with low vitamin D levels and poorer mental health. So it is, I think, really important to just understand that. And even in your darkest days, if you can pop yourself outside to experience some sunlight, watching out for burns, of course, you don't want to be out there too long. And in the summer, you don't need to be out there very long at all, actually, to get a daily dose of vitamin D. In the winter, I think it's 20 minutes or so. But exposing your skin. And for best results, apparently, it's back, bum, and tum. So the places that don't normally see the sunlight are the best places to actually get your vitamin D levels. So that's just something to really be aware of, definitely associated with mental health. And another thing, mindfulness and meditation. You may have heard about mindfulness and meditation before, and for some people it's like, how on earth does this help our mental health? But there's lots of research around how mindfulness can be incredibly important and a lovely tool to use when it comes to our mental health. And part of it is that it teaches us to watch our emotions come and go without really getting involved with them or believing our monkey mind that tells us all sorts of things, that we can become an observer of our mind, and that we're not owned by the monkey mind that does the talking to us. We've all got that. And mindfulness and meditation can also help find a space between difficult emotions. And it can also give us time to think about or to process something before we react to it. So mindfulness and meditation can be very powerful. It's a very powerful tool to use. and supporting our mental health and well-being. And mindfulness has been shown to decrease stress response and cortisol levels in our body as well. So that's something else that mindfulness and meditation does. So really, when I talk about these sort of things, this is what I consider to be self-care. Like, these things are really at the base of self-care. Like, we often think about self-care, we go, oh, my self-care is massages or getting my fingers done, and there's nothing wrong with massages or getting your fingers done. But if we don't get on these real basic things, if we don't really focus on these things that are long term, that are really going to sustain us, doing these fun other things aren't going to give us that long lasting change. And I think it's a really important concept to understand. And sometimes these things aren't fun. It's not always fun to eat bloody vegetables. I get sick of eating vegetables sometimes. But actually, when I know how well I'm going to be keeping, well with this diet, or I'm going to be keeping well by going to bed at a reasonable hour, it really does give you some power. And to me, it makes me feel empowered that I can have a little bit of control over how I look after myself. So this is just a pyramid that I put together. It's not necessarily all in this order for all people. For some people, mindfulness and meditation might come before these other things. I mean, but it's just an idea, and that these sort of things are really, really important. And that is the talk for those that are here. Thank you. And I will stop my share screen and have a look at the chat. And actually,